Hello, this is KHURRAM Nasir and you're watching Optometry with KHURRAM, and today's topic is about the pseudophakia. In this video, we will learn about that how we can prescribe the near addition in a uniocular pseudophakic patient. So before learning about the pseudophakia and the near addition, let's discuss about the three different terminologies. And the first one is called the phakia. The phakia is a condition in which a person has the natural crystalline lens, right? Phakia, the term phakia means lens, the natural lens. So we have a biconvex natural crystalline lens inside our eye in the posterior chamber, right? So a person having a natural crystalline lens is called the phakia. This condition is called the phakia, and the patient is called, or the person actually is called a phakic patient, right? And the second is called aphakia. And aphakia, A here, A mean absence, right? And phakia mean lens. So aphakia mean the absence of the natural crystalline lens. If our eye has not a crystalline lens, a natural crystalline lens, that condition is called aphakia, and that patient will be a phakic patient without any crystalline lens, right? Or without any lens. And the last one is called the pseudophakia. Pseudophakia. So pseudo mean the fake, right? And phakia mean the lens. So pseudophakia means a fake lens, a artificial lens, a intraocular lens, right? Which we implant after the cataract surgery, right? So now let's discuss about the short discussion about the intraocular lenses, right? So we have many types of the intraocular lenses. The first one is called the anterior chamber intraocular lenses, and the second one is called the posterior chamber intraocular lenses. We have iris supported intraocular lenses as well, and we implant the anterior chamber intraocular lenses to treat myopia. So these anterior intraocular lenses are actually the concave intraocular lenses to treat myopia, but there are some disadvantage of these anterior intraocular lenses, and the disadvantage of this intraocular lens is this intraocular lens can hit the trabecular meshwork and it can disturb the intraocular pressure inside the eyeball, and it can cause glaucoma as well. And these anterior chamber intraocular lenses can create a negative impact on the cornea, like the endothelium of the cornea, the endothelium lining of the cornea. And now we will discuss about the posterior chamber intraocular lenses, right? We implant the posterior chamber intraocular lenses after the cataract surgery. For example, if patient got cataract, right? So we will remove the natural crystalline lens which has cataract, and we will implant a fake or artificial or intraocular lens inside the eye in the posterior chamber, right? In the envelope of the natural crystalline lens, in the capsule of the natural crystalline lens. So these posterior chamber intraocular lenses are used to treat the cataract, right? So they will replace the cataractous lens, right, as intraocular lenses, right? And now let's discuss two different cases about the near addition in the pseudophakic eye. For example, a patient is there having age of 20 years, and he got the cataract surgery in that specific age in 20 years, right? So the right eye of the patient, so we have two different eyes, the right eye and the left eye, right? For example, this is right eye and this is left eye. So in the right eye we got the cataract surgery, right? And the left eye is fine, no surgeries, right? So the age of the patient is 20 years, right? So the age of the patient is 20 years, and you know very well that in 20 years of age the patient has enough amplitude of accommodation, right? So patient can accommodate very readily, very easily, right? But unfortunately the patient got cataract in the right eye due to trauma or anything, right? Or congenital, whatever you can say. So in the right eye we got cataract, right? And due to this cataract we have to perform a cataract surgery, and we remove the natural lens which was cataractous, and now we implant a artificial lens. Now this eye is pseudophakic, right? Because this eye got a fake lens or the artificial lens. So how we can prescribe the near addition? You know very well that near addition actually is the replacement of the accommodation, right? So the left eye do not have any surgical procedure, so this eye can accommodate very easily, but this eye has the intraocular lens, actually the fake lens, the artificial lens. So this eye do not have capacity to accommodate, right? The pseudophakic eye cannot accommodate, you know very well, right? So why? Because it does not have a natural lens, it has artificial lens, right? Artificial lens, right? So that's why it is called the pseudophakia, right? So we want to learn that how the process of accommodation is there in this patient, right? In which the one eye is fine and one eye is pseudophakic. One eye is phakic, actually having lens, and one eye is pseudophakic, having the artificial lens, right? So you know very well that this eye can accommodate very easily, but this eye cannot accommodate. So if we want to prescribe the near ad, right? So how we can prescribe the near ad in this eye? Because this eye cannot use accommodation. This eye can accommodation, can have accommodation, can exert accommodation, but this eye does not, right? So the first mode of treatment is that do not prescribe anything for reading. Do not prescribe near ad. Why? Because this eye has an artificial lens, right? This eye is totally fine at distance. So both of the eyes are fine, both of the eyes having 6/6 of visual acuity at far distance. So there is no any problem at the far distance. And when this patient will look at the near, he or she will feel some problem, somehow feel some problems. But you know, the left eye do not have any refractive error. This left eye do not have any surgery. This left eye do not have any intraocular lenses, because this is phakic eye. This eye has a natural lens. So this natural lens can accommodate. So the patient will use his or her left eye for the reading and both eyes for the distance. So first mode of treatment is do not prescribe anything, right? If the age of the patient is less than 40 years, like if the patient is of 30 years, 25 years, 20 years, 10 years. So if the patient is pseudophakic in one eye, patient has uniocular pseudophakia, do not prescribe anything as addition, at near addition I'm saying, right? So we will not prescribe anything for near addition, right? So patient will look with the both eyes at far distance and he will be 6/6 if he or she has not any refractive error, right? If he or she has a refractive error at distance, you can treat that refractive error, right? But at near, patient can use this eye, left eye, for the reading, right? And he will not use this eye, the pseudophakic eye, for reading. So this is one of the mode of treatment, right? And we will discuss how, if we want to prescribe, if patient is having complaints at near distance, because this eye is pseudophakic, this eye is unable to exert accommodation, but this eye is exerting accommodation. So if patient is having some asthenopic symptoms, then we have to prescribe a near ad. And how much near ad we will prescribe, right? So it depends on the working distance, right? That what is actually the normal working distance of that patient, right? We will ask the patient that what is actually the profession of that patient, right? And accordingly, we will have a normal working distance of that patient, right? So for example, the working distance, and you know very well that in 20 years of age or in 30 years of age or 35 years of age, the normal working distance is approximately the 40 centimeter, right? So if the working distance is 40 centimeters, so we can calculate the addition with the help of this working distance, right? So we have patient and we can ask the patient that what is actually the working distance. We can measure that working distance with a scale, and approximately normally the working distance, the normal working distance in an adult is 40 centimeters. So we can easily convert this working distance with the formula, and formula is d is equal to 1 over f, right? So d is dioptric value, the power, and f is the distance, actually the working distance. So we have 1 over f is 40 centimeter, and this is in centimeter. We will convert into meter, and we can write it as 100 over 40. So 100 over 40 will be plus 2.5 diopters. So we will prescribe 2.5 addition in the right eye, in the pseudophakic eye, right? So how much we can prescribe in a pseudophakic eye, in a uniocular pseudophakic eye or bilateral pseudophakic eye, it depends on the working distance. If the working distance is 40 centimeter, you can prescribe plus 2.5. And now we will discuss another case. Now the age of the patient is 45 years, 45 years, right? So at 45 years of age, you know very well that the rest of the procedure is the same. The rest of the phenomena is the same. One eye, the right eye is pseudophakic, left eye is fine, right? Left eye is 6/6, right? So this is the scenario, but now we have changed the age of the patient. And right now, in this case, is this scenario, the age of the patient is 5 years. And you know very well that after 40 years, presbyopia is there, right? The presbyopia starts after 40 years. So in 45 years, there is very least or no accommodation in that patient. The amplitude of accommodation is very less in this age group, in 45 years of age. So it is confirmed that both of the eyes cannot accommodate. Accommodation is not there in this specific age after the 40 years. Now the age of the patient is 45 years. So in 45 years, there is no accommodation, very least amplitude of accommodation. So how we can prescribe if the patient is uniocular sort of pseudophakic, right? So how we can prescribe the near addition? You know very well that in a tentative method, we prescribe +1 or +1.25 in this specific age, in this 45 years of age. But this is a tentative method, right? The trick and trial method, right? But right now the patient is pseudophakic, and in this eye patient cannot accommodate, right? Because the age is presbyopic age. So the left eye cannot accommodate because presbyopia is there. Our right eye is already pseudophakic. So pseudophakic lens, or you can say the artificial lens, cannot accommodate. So there is no any question, there is no any possibility of accommodation in that case. So how we can prescribe the near addition in this situation, right? The thing is the same. We will prescribe according to the working distance. So for example, if the working distance is 40 centimeter, we will prescribe, right? But I'm talking about this right eye, in a pseudophakic eye. In a pseudophakic eye, the working distance is, for example, 40 centimeter. And in 40 centimeter, we have already calculated that the near addition will be +2.5 in a pseudophakic eye. But tentatively, we usually prescribe +1.25 diopters in the left eye, because this eye does not have any intraocular lens, or does not have any cataract surgery. So this is fine. So this eye got cataract surgery and eye is pseudophakic right now, and according to the working distance of the patient, we prescribe +2.5 in the right eye, 2.5, right? And I'm saying over and over again, it depends on the working distance, that how much we are going to prescribe near ad. How much near ad we are going to prescribe, it depends on the working distance of the patient, right? It depends on the comfort zone of the patient. It depends on the pupil constriction and dilation of the patient, right? And remember one thing, this is very important thing, that you also check the dilation or constriction of the patient in a normal situation, right? If a pupil is more constricted than the normal at reading, right, it will give the more depth of focus to the patient, and it will increase the visual acuity at near, right? So there are so many factors of near addition, prescribing near addition, like the ease of the patient, the comfort zone of the patient, number one. Number two, the pupil constriction at near. Number three, the working distance. And the most important thing is working distance. So I hope this is clear, and we'll see you in the next videos.